about that. Welcome everybody, and I know that on our Zoom call we have one of the donors for this program, and I just wanted to say a little bit about the program. This DELV lecture is an annual lecture. It's a multi-day faculty exchange here at the University of Washington in the field of global health, and it's to benefit the knowledge of the department's faculty, staff, and students. And we wouldn't be able to do this without the generous support of two individuals, Carrie Rhodes Nigam and Vishal Nigam, who went ahead and made this program several years ago. And the purpose of this endowment is to benefit knowledge of the department's students, faculty, and staff. And it's the intent of the donors that lecturers shall be distinguished scholars who are researching, implementing, and/or developing programs which benefit the health and well-being of women, adolescents, and children. And we've had a variety of different speakers. I'm just going to put up this next slide just so you can see our prior speakers that we've had in this position. And each time we've learned a lot from different areas, thinking about global health, thinking about the role of the Ministry of Health, thinking about children, thinking about women and adolescents. And so today we're here to hear from somebody very special. And this is this year's speaker for whom we don't yet have a slide. But I wanted to just spend a moment talking about our speaker today. This is Dr. Nithya Ramanathan. And for the first time, we're going to have somebody who's had a career who focuses on applying technology to solve large-scale problems. And this started very early on. Even in her PhD, she started developing and deploying high-tech sensor networks to monitor arsenic levels in groundwater in Bangladesh. She's had faculty research positions at UCLA and led teams to develop smartphone-based apps for monitoring diet, stress, and exercise. And then right after graduation, she founded this really interesting 501c3 that we're going to hear a little bit about called Nexleaf Analytics. This is one of the earliest companies in global health to design and manufacture real-time sensor tech in global health with the aim of adapting cutting-edge technologies to eliminate childhood mortality from vaccine-preventable illnesses. Nithya is widely recognized as an expert in the development of technology for global health. She's a TED Fellow, Pop Tech Innovation Fellow, and the winner of numerous awards, including the 2020 Thalberg Global Leadership Award. She's presented her work widely in peer-reviewed journals, including a publication in Nature Climate Change. So in this talk, we're going to hear Nithya share about her work as the CEO and co-founder of Nexleaf Analytics. And this nonprofit is building solutions for holistic digital transformation for governments across Africa and Asia. She'll talk about how it integrates and centers with the Ministry of Health and trying to figure out how we don't think about technology simply as a silver bullet, but how do we collaborate fully? So as you get ready to start, I did want to note that bringing this together was not only the good fortune that we had from the generous donation from Carrie and Vishal, but also a lot of background work, including by Hannah Atlas here, who's coordinated the program, Stephanie Evelyn Cho, and you're going to hear more from our other co-directors of Global Watch throughout today and tomorrow. Patty Pavlanak, one of the co-directors, will be taking questions at the end, and we hope this is interactive. Dr. Ramanathan has said that she doesn't mind being interrupted. For people who are on Zoom, it's a webinar, and so you can put questions in the chat and the Q&A, but I'm not sure you'll be able to see them till the end. Yeah. Oh, Allison will raise her hand on your behalf. So anyway, let's welcome Dr. Ramanathan, and I look forward to hearing from you.
Great. Thank you so much. And actually, really quickly, Allison or Hannah, when do you want me to wrap things up by? So that Patty has time as well. Oh, okay. Okay. Yeah. Okay. Perfect. Great. Yeah, sounds great. Okay, well, thank you so much for having me here. I've been really looking forward to this conversation. I think, especially right now in a time of just crazy turmoil in our country and our world, it's really a relief, honestly, to get out of my bubble and be able to just kind of interact and learn from all of you as well. So I very much hope this is a conversation and exchange. So as Grace mentioned, please do just come into the conversation however and whenever you feel. So one of the things that I understood that I'm maybe one of the first technology entrepreneurs to come give one of these talks. So I thought I would actually spend a little bit of time kind of just sharing my own journey as an entrepreneur. And I hope one of the things that people take away from this conversation is actually how relatable my path has been. Very far from like a straight and narrow path. It's been somewhat meandering. In this conversation, I'll actually kind of have roughly three parts. The first part, I'll just share my own journey and kind of how I got there and began working in health systems. And then the second part, I will talk about our scale. And I'm not very good at kind of bragging, if you will. And so I do tend to skip over that part to get to the third part, which is kind of all the interesting hard problems that are there to solve in order to get to scale. And I was with a friend of mine, Oren, who was the longtime director of immunization at the Gates Foundation. And he was sort of chastising me. I was telling him about the talk, and he was kind of chastising me about that. And so that, gave me pause. And so I will say, please do feel free to ask more questions. Happy to share, whatever we've learned. And ultimately, I just want this to be kind of useful to all of you as you think about how you're scaling your solutions. So with that, I think I will start with, actually, yeah, just a little bit of intro. So as I shared the journey, I was an electrical engineering major before I got more into computers. And I picked that major for a very arbitrary reason. So I had a high school counselor who told me that electrical engineering was really difficult for girls and that girls really should, consider picking other majors. So I, of course, immediately was like, I don't know what that is, but that is what I will be doing. And so I did that with not a lot of purpose, quite frankly. And I found the work kind of interesting. And I started working for a while in Silicon Valley. This is right as the dot-com boom in the late 90s was getting going. And through that, I sort of decided I was going to kind of go a little deeper into technology. So I decided to do a PhD in computer science. Also, because I really just didn't know what else to do, quite honestly. And in my family, if you don't know what to do, you go get a PhD. So that was really, kind of the well-founded logic there. And there's a few things happened. I had an incredible mentor, Deborah Estrin, who's one of the early internet pioneers, and she let me sort of explore and, oops, wrong computer. Let's see. There we go. So she let me explore. And so she was running a lab that had a bunch of NSF funding to think about sensors and real-time data and analytics. And this was like early 2000s, well before the iPhone. And so I was one of those very rare computer science PhDs who spent a lot of my time knee deep in mud, thinking about okay, we can come up with time synchronization algorithms and routing algorithms and optimizations. And that's all well and good. And I had to do all of that. But I really wanted to think about how data would serve people. And so I ended up picking a problem in Bangladesh to study, which was arsenic poisoning, and looking at, why was there so much arsenic in the groundwater? It turned out at the time it was something that we knew was really bad for people, but we didn't understand why it was happening. And so there was a thought that better data, better sensor data, embedded sensors could actually help us really uncover the physical models underpinning all this arsenic. And so through that process, though, I ended up getting really connected with the communities and ended up spending just as much time, in the households as I did in the fields. And what I came to realize is that people there were so excited for this research because they said, finally, people will believe us. And I was like, oh, why? What is it about this research project? And it's like, oh, well, sensors. Sensors are going to prove to the world that there is a real problem. And that was like one of my light bulb moments because I was like, how about the fact that people are getting sick and all these other things? And it's like, no, sensors are really, there's this belief that sensors don't lie. And so that was really interesting to me. And then, of course, I started to realize like I was just a grad student and I was there to publish a paper, and that was going to do nothing to actually solve the problem. And so I had this great idea. I was like, I know, we'll dig a well and that will solve all the problems, and fresh water will be available and everybody will be happy. And so, I quickly raised some money from my family, mostly, quite frankly, and we dug a well. And then 2 weeks later, I realized, wait, who's going to fix this well when it breaks? And all the things that kind of come with global development, that all of us face on a daily basis. So that was kind of my introduction to development before I actually entered the field. But that really stayed with me. And so after grad school, I did a research faculty position. I ended up doing some research in developing some of the very early smartphone-based activity trackers, again, well before the iPhone, and found it really interesting, but decided to leave academia because I really was obsessed with scale. And I realized that there was no sort of good match with my obsession, which I cared about above all else, and kind of really going deep into the sort of fundamental discoveries that academia, was more organized around. And so I decided to start Nexleaf. I did start it out of my garage, as all good tech entrepreneur stories happen. And was really fortunate to work with a really incredible team right from the get-go. So back in 2009, we started. So fast forward, I want to shift gears and tell you a little about how then the work of Nextleaf really got going. Hi, Maureen. So nice to see you. So I want to shift gears and just share a little about how our work at Nextleaf got started. So when we first started, we were sort of a hammer in search of a nail. We kind of knew how to build really cool sensors, but wasn't really sure, where the big problems were to solve. And so to kind of explain my entry point into this, I'm actually going to take you back to the year I was born. And that's, I come from a line of storytellers. Like, this is how we tell stories, is we go back to the beginning. And so the year I was born, actually, something really important happened, which is that the world came together and decided that global vaccination was going to become a issue of global kind of concern and coordination. So this is 1975. And this is when the EPI program essentially was born. And that was essentially this kind of consequential thing that happened that really enabled us to now have vaccination the way that we know it to be true around the world. And so, I experienced it because I spent a lot of time in India with my grandparents. And so I actually literally saw the ways in which polio, which initially when I was young impacted, children my age. And, you would see with children, adults, everyone, all of the disfigurement. I slowly saw as I got older, literally seeing this disease go away. And so it's one of these like really tremendous kind of miracles of global cooperation. And so I got really interested in how that works, how it happened. And I mean, just like a quick detour, India is one of the big success stories in eliminating polio. And it's incredible. I mean, India has something like 26 million babies a year that are born in the country. And it is a centralized health system. And so every year the government manages to vaccinate 26 million babies. It's just incredible. And so, it kind of takes this like tremendous countrywide coordination to really kind of make this happen. So it's a really tremendous thing. And part of it underpinning it, as I'm sure most of you know, is really a complex supply chain. So refrigerators. Vaccines do have to be kept cold. Refrigerators are a critical part of that. And these refrigerators, have to be mobile, on boats, motorcycles, on foot, but really kind of need a lot of technical capability to sort of keep this mobile supply chain operating and functional. And so And the reality is that actually, kind of similar to what I learned about in my PhD program with equipment breaking, it turns out that the same thing happens with refrigerators. So refrigerators break at kind of an alarming rate for vaccine supply chain. So the global data, the WHO data says something like 40% of fridges fail. Our sensor data says something a little less, but largely speaking, though, a huge number of fridges fail, and this actually has alarming consequences. So, we've been able to model out, because we have detailed data on these fridges, we've been able to model out the more precise impacts on vaccines and vaccines going bad. And it impacts something like 10% of children every year around the world are probably getting vaccines that are less than or not potent at all. And it starts to explain the outbreaks that we know and see, and across especially Africa and South Asia. And this is something governments are very aware of, actually. So it's one of those KPIs, if you will, that governments really hold themselves accountable for, is the severity of outbreaks in the country. So this issue is a really big one. And the way that fridges, for the most part, were managed, and I'll use UCLA, which is my home in Los Angeles. The way the vaccine fridge at UCLA was managed until like 10 years ago, probably, was with a really similar paper chart. This one comes from Haiti, but the picture from UCLA looks very similar. So it's taped on the fridge. People write down the information, and the cold, hard truth is that nobody looks at this chart ever. And, the chart is sent to the district supervisor if you're in Kenya, and then it'll, eventually make its way actually all the way to Geneva and to the WHO. But the reality is that nobody looks at it. And so the consequences are that fridges can go bad and be, failing for days, weeks, months at a time, and vaccines will go bad. And so one prominent example, actually, just happened to know about because I knew somebody there, was at Stanford, where actually it turned out the fridge had been largely broken for 9 months. And so they literally had to vaccinate, I forget now, but revaccinate 1,500 kids. So very much a reality. And the challenge is that, outside the US, that information isn't necessarily known. There aren't necessarily ways to deal with it. So in reality, what happens is that mothers think their children are vaccinated and they aren't. So this is the problem that we decided to take on. And in no small, accident or coincidence, I should say, but because, what I saw with wells in Bangladesh, like, really haunted me. And I thought, okay, this is a problem that we can, like, really get our heads around. Like, how do you keep equipment running? And so, the real title of this talk is that shit breaks and nobody wants to fix it. And that's really kind of what we have been, the problem that we are on a mission to solve as a nonprofit, which I should mention. So Nexleaf is a nonprofit. And I'll say a little bit more about that in a minute, but I'm actually going to pause, drink some water, and see if anybody has questions before we go on here. Okay. So, so how did we solve the problem of paper charts and broken fridges? Spoiler alert, we're still working on it. But let me share what we've done so far. Oh, yeah, so I should mention, and this image is actually sourced, I should say, from NPR, but it is sourced from a hospital where we do work in Malawi, but it is not my photo. But this is a very poignant photo of an equipment graveyard. And this is really what happens. So fridges may stop working. Nobody knows where the spare parts are. The manual's probably lost. And people may or may not have attended the training. And the best, fastest, cheapest thing is to actually toss it in the heap. And I don't blame them. We all do versions of this all the time. So when you're in a big health system, this is kind of the reality. So what we're really interested in is how do we kind of help solve this problem? So What we ended up designing, and actually I meant to include the first device. So I'll actually just tell you a little about the very first device we designed, because it was, I mean, this isn't very sexy, but the first device we designed is much, 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 much less sexier. So it was very clever though. So it was a smartphone, a cheap $40 Android smartphone. And we had figured out this super clever way to connect a 30-cent thermistor to the smartphone over a headset jack. And this was back, my co-founder and I, Martin, who we'd done our PhDs together as well. So Martin really did most of the heavy lifting to figure this out, how we could do this. And so it enabled us to build a very fast, quick, easy to modify temperature sensor that could easily send out SMS alerts and everything in like a few weeks. It was super cool. And so that was the very first device. We ended up, kind of using that to really prototype in hundreds of facilities across Kenya and Mozambique, excuse me, and really getting to work and understand what are the challenges that nurses face. So anyways, this is not even the most recent device. It's just the picture that I found last night. But this is one of the interim devices that we then started manufacturing at scale. And so this device essentially monitors the temperature of a fridge. It monitors the electricity of a facility, and then it can send out a real-time alert when there's a problem, and also make the data available. So great, problem solved. And so, as I mentioned, SMS alert goes to the nurse, and data is made available to her supervisor, who can access it regularly. And then alerts and other information can make it to the technician. And so really kind of one of the first lessons we took is that like fixing a single fridge does actually take a village. And so it's not even just the 3 people I'm showing you here, but it also relies on the National Ministry of Health and the national logistician. And, they need to get spare parts, and they need to kind of play their part. So there's so many people who actually have to kick into gear to fix a single fridge. So really not straightforward. But this device was our first step, and we've managed to scale it, and it's been really incredible. So this device, and actually this number is a little out of date here, but anyways, this device is in over 25,000 facilities across over 20 countries. The device itself protects the vaccine supply for 1 in 7 babies born on Earth each year. So just incredible scale. And part of it is just figuring out not only kind of the right device at the right time and really kind of understanding the challenges, but it has been our approach to partnership, which is that we have always kind of prioritized the Ministry of Health and said, okay, this is your supply chain, these are your problems. Like, what more can we do to solve the challenges that you're experiencing today? And so it's been that approach to partnership that I think has really brought a very different lens, just in terms of a technology solution that doesn't just get plopped into a system, but rather, kind of a more holistic approach to it. However, we found that having a sensor helped solve something like 30% of the fridge failure problem. So in other words, roughly speaking, about 30% of failures were straightforward enough that just having an alert and knowing that my supervisor, is also looking at this information and, kind of overseeing this, that was enough to solve something like 30%. So it'd be easy things like I can adjust a thermostat, or, maybe the power went out and I can switch over to backup. But it still didn't solve a big portion of the problem. And so, we're still thinking about, okay, 10 million babies a year getting vaccines that are, likely gone bad. Maybe, we've solved a small portion of that based on our scale, but not nearly enough. And this is one of the challenges that we constantly face as entrepreneurs, is how much of the problem do we really want to bite off and chew? I mean, is this really our problem? We set out to like monitor fridges and get that data to ministries and make sure they had it. And we've kind of done that. But we decided as a nonprofit, though, that really ultimately our goal was fridges that work for potent vaccines. So this kind of led us to this sort of, I'll just briefly categorize like silver bullet syndrome, which is that I think there's a real temptation in global health that is promoted by, funders and everybody else, right? Like we all sort of reinforce each other on silver bullet syndrome, which it's very this like sort of persistent desire to find that single solution that's just going to work, regardless of the realities on the ground and the systems and the countries and the processes and what might already exist. And so, really thinking about, okay, what else do we need to do so that the data actually drives actions so fridges get fixed? So that's become like the last, 7 years or so has been kind of this next phase of our journey, is really trying to understand that. And, one thing I'll say is the reality is that, this picture, while it's very graphic, I keep this picture in mind. It's why I wanted to share it with you, just because this is one of the kind of driving forces for me. And it's kind of knowledge that we know there is waste in public health, and it's for all sorts of reasons. And, we can't like optimize everything to zero. This isn't like an engineering problem, but being able to really kind of think about like, what are we going to do differently and how are we going to meet this moment, is something that I'm super interested in, like thinking more about and kind of understanding, how you all see it as well. As we think about like, what are we going to do differently? How are we going to partner with countries differently? Like, how are we really going to ensure that whatever it is that we're building gets sustained and owned and has a system to manage it? So, this is kind of like my motivating image. But overall, basically, to kind of capture, before I get into sort of this final phase of what are the kind of remaining hard problems to solve in order to solve a problem, what I'll just say is that this sort of captures our approach. So what we really try to do, and we're far, far from perfect, but what we really try to do is think about this not as like what I tell my team is like no transition plans. I don't want to hear about like how we're going to build something and then 3 years later we're going to transition it to government, because the reality is that rarely happens. And everybody has good intentions, like we're all trying, but the reality is that when we design it that way, we just kind of design it wrong from the beginning. And, it's really tempting to be like, well, but I want to know if this thing works. I want to know if this new clinical device works, or this, new pill or whatever it is. So I'm going to like, give it the best shot, and then I'm going to transition it over. So, I mean, it very much comes from a good place. But what our thesis is going into this next phase is that transition plans aren't going to work. And especially with the collapse of global aid, what we're saying is, there's no big aid donor waiting behind the scenes to pay for these big solutions. Like, whatever is there, that is there. And so how are we going to design solutions that fit into that? So then as we think about, we're technologists and, we are a tech company. So whatever technology that we build, how do we also think about investing in the people and in their processes and their skills right from the beginning, and what's needed there? That's the first part of it. And then the second is, really thinking about what are the problems and solutions that ministries really want today that they will sustain, because they really need it. They'll pay for it. They'll sustain it. So this is, kind of our approach in 2 bullets. Okay. So I think, yeah, to get into then this third part of the talk and kind of the hard problems to solve, what I want to do is just share a few examples of some of the work that we found that it's taken for us to kind of implement this no transition plan policy. And so in the bottom line is that everything takes 20 times longer than you think it's going to take. I mean, that's basically the lesson. And so one of the things that, has been really important, and this is just an example from Rwanda, I tried to pick just recent things. So recently we signed an MOU with the government in Rwanda. Getting to this point took something like 6 years. And I mean, I'm not exaggerating, but of course there was a lot of downtime. COVID happened, all sorts of things happened in that 6 years. But like from when we first started engaging the government to finally getting an MOU, it really did take a long time, even though the government, which is not one person, of course, but that there was a lot of motivation to work with us and kind of do this. But yeah, and yet the MOU has been such a like critical thing, because now that we have an MOU, everybody just points to the MOU. Nobody's really sure what's in there anymore, but it's like, oh, well, the MOU's got it covered. So, we can work together. But this was a really important lesson for us, because we kept skipping this step because it was taking so long. And the government would be like, well, let's just, do some stuff over here or some stuff over there. But we found nothing really took hold because we didn't have a framework to work together. So this ended up being really important. This is something I'm really proud of. So, I showed you a picture of the device, and this device, as I mentioned, is scaled in many countries. And the reality is, though, that we've been running all the trainings for this device. So anytime the device gets scaled, we, call everybody to the Capitol, and we run the training, and, we're kind of up there like, okay, now you got to do this and that. And part of this no transition plan was really starting to ask ourselves, okay, what does it really look like? If the government is saying they really want this, like, what does it look like for them to run the trainings, and not only to develop it, but to actually run it, and for them to kind of, in their voice, say, what matters most, and for their team and their people to hear from them that, this intervention matters. So this is one of our first, I'll be honest with you, it just happened like a few weeks ago. One of our first completely ministry-led, ministry-implemented trainings. And so, we were very much tech support behind the scenes, offering kind of input and guidance. But this very much was driven by the government. And so, and this is happening because Tanzania just decided to renew their entire implementation of devices. So they had an older version of our device, which I showed you. They wanted to upgrade to the newest version of the device because it's been 5 years. So they just purchased those devices from us. And so we sort of sat down with them and said, hey, what do you think? Like, maybe you guys should really take this on, we're here for you. And so it was very much kind of done in partnership. So the ministry just led this training in Tanzania, which was really exciting. And also, as part of it, one of the interesting things is they really then leaned into like, okay, we better figure out all the roles and responsibilities, all the SOPs, like all the things that everybody knows are needed for a good program. But because they were on the hook, they were suddenly like, oh yeah, let's get serious about this. Like, we really need these things. So there were all sorts of good things that came from that. And then the other thing is co-creation. And I'm fairly sure that all of you know way more than I do about co-creation, but I thought I would just, throw it up here still. So co-creation has been such an important part. And it's been really interesting to us because the way that we work, as I mentioned, it takes a village to fix a fridge. And so we tend to work with everybody from like the nurse in the last mile facility to the technician, and kind of all the what we call hidden health workers. So these aren't necessarily the people who are on the front lines of patient care, but they're all the ones who are needed to make the supply chain and the health systems and the electricity and all of it work. And so we brought all of them together. And they had never, in Rwanda, they'd never gotten to take part in a co-creation workshop, which was super interesting and surprising to us. And so they were like, yeah, nobody ever cares about us. Like, we're the nerds and the technicians and, the people who are just like, everybody just expects us to like kind of keep things running. And so it was really interesting to think about like, who does tend to get the attention in the government and kind of all the design resources and all of that. So anyways, running co-creation workshops, which also, takes a long time, so much longer than you would think, just trying to find the day and all of the kind of nuts and bolts of that. But, it's really produced because the government's really kind of essentially run these. They're the ones kind of developing all of the content, all of the programs that are needed to actually take this data and connect it to, okay, how are we finally going to fix fridges? And so this is just a really simple graphic, but like when we think about any technology, so you could take an incubator, which is in the middle of this diagram, but all the diagnostic devices and medical equipment, ventilators, even solar panels, anything that is sort of equipment needed to help a health system or ensure a health system runs well. Basically, what we've seen is that you sort of need you need to focus on the data about that, the processes. So, what are the daily and weekly routines that people use to manage this piece of equipment? You need to think about the upskilling for people to ensure that people know how to manage this equipment and use it and fix it. And ultimately, that's, how action happens to kind of keep the equipment running. And these are all the sort of operational aspects that have nothing to do with patient care. So, and the reason why I show this is because one of the things that's become really clear to me is that as we see more and more interventions rolled out, there's a real focus on the clinical workflows. So, which doctor is going to use this, or which midwife or which health worker is going to use this to treat, which disease. And then how are we going to make sure that, there's like the treatment for that disease, like all of the kind of clinical aspects or all the data that goes in the electronic medical record. That is like really much better worked out. But then there's all these operational aspects to keeping any device running, and that is like largely ignored. And so that's basically a big part of like what we focus on is really kind of getting those operational things going. And so these are the 4 things that we really think about as part of that. I'm going to pause here before we get into kind of this, see if there's any questions now. Yeah.
I have a quick question about what would tell us how it landed with that level? Is it donors like Gates or Gavi saying you really need to be interested as well, or is it governments that approach you? Like how did went that set?
Yeah. That's a very good question. So I think I'll skip forward just for a second to answer that question. So our solution has 4 parts to it. The first part is the device, which I've mentioned. And so it did start like, okay, so the 10-year journey is that initially it started with Gates saying, okay, we need real-time data. This needs to be a thing. They funded us to actually like kind of prototype and build the evidence for it. And then when there's enough evidence, then Gavi, as you mentioned, took over and actually started allocating health system strengthening budget specifically to these devices. And so Gavi, if you ignore COVID, Gavi gives out something like $1.5 billion a year. Most of that goes to buying vaccines, but a small portion goes towards health system strengthening. And then you slice and dice that some more. So it wasn't like a ton of money, but basically we helped create that market through Gavi. And so Gavi actually like allocated money specifically for this class of devices. And so actually we basically helped bring in 6 other competitors. And then we competed in this market alongside the competitors to sell these devices to countries. And this was like a huge no-no. We were the only nonprofit in the space trying to sell stuff. It was like a whole other can of worms, which I'm happy to answer questions about. But to get to your question then, essentially now it is countries coming to us. And so we have like a whole sales process, and countries will they will have heard of us through all sorts of different means. And then the government will say, okay, we want to buy this. Or the reality is sometimes there's a UNICEF country office, person who's really motivated and says, we want to buy this. But ultimately, like the government really has to be on board. But then they approach us and then they purchase the devices through a sales channel of UNICEF. But yeah, they very much approach us. So to answer your question of the countries, so, I mean, we are in many countries, but in terms of like countrywide scale, so it's mostly Kenya, Tanzania, Malawi, soon to be countrywide in Rwanda, and then Pakistan, soon to be countrywide, and India. So India is our largest scale. So we're in most of the facilities across India. And that did start with a push from Gavi and Gates. But now is actually, I'm very proud to say, the government of India has put it into their official budget. So now the government of India completely finances it. And in theory is supposed to be now this month planning to buy another 45,000 devices from us to expand to the animal vaccine cold chain. So while everybody else is sort of pausing everything because of the global meltdown, because the government of India actually put it into their internal budget, they don't care about what's happening everywhere else. Yeah. Oh, great questions.
I have two questions. One is how is the power of this family product, how is the maintenance?
Great question.
Second question on the data, what is the data share?
Great questions. I really enjoy talking about that. So the easy question first, it is powered with a battery. It's got a lithium ion battery, can run 5 days, but it also plugs into the wall. And so it's a rechargeable battery. But the reason, partly the benefit of doing that is because then we get to monitor the power at the facility. So there's some trade-offs, you know, if there's no power for more than 5 days, well, yeah, the data stops. But that's how that works. In terms of maintenance for this device, so the reality is we are still figuring that out ourselves. And what the current model is that we ship 10% spare parts with the device. And then we support the government in actually managing the spare parts and the replacements in order to handle all of the maintenance themselves. And I'll share in a few slides, I'll also share how we do trainings now for the government to make sure that everybody actually knows how to do it. So I'll get into that in a minute. But far from a solved problem is the very truthful answer. And then your question of data ownership and data sharing is such a good one. One of the things that we found when we first started working in this space was that actually countries could not access their data. We brought in competitors, and then it turned out that countries weren't able to access their data from any of the competitors. And even honestly, like from us, we were having some trouble because one person would get access, but everybody else had a harder time. Like it's quite complicated to manage, you know, kind of dashboards and usernames and all of that. And so while we started really actively solving that problem, we saw that there was nothing holding manufacturers accountable for ensuring that countries would get access to their data. And then the other thing we started hearing from ministries is that they were really frustrated because they would show up at conferences and they would see, you know, a vendor like us or a researcher or somebody presenting results from their country that they might not have actually seen yet. And, you know, sometimes the results were embarrassing, or sometimes they just were wrong because, you know, somebody didn't have the context and, you know, hadn't kind of consulted the right people. And so we saw this kind of like constellation of problems that we felt really came down to data ownership. And at the time, and this was like 2010 maybe, there was digital health principles, which were you know, very common in global health. And the digital health principle said nothing about data ownership, which was really fascinating. And so we actually worked with the head of Gavi at the time, Seth Berkley, and kind of brought this problem to his attention. And he was surprisingly really receptive. And so he actually let us author a statement for him that said that countries owned the data. You know, if they bought the device, they owned the data, full stop. He was in his statement, he was like, I'm shocked that I even have to say it. And I was like, no, Seth, but just trust me, you have to say this. Like, this is far from, you know, the reality. So, you know, he sent it out to all the manufacturers. We received one of those letters, which was, you know, very fun to be like, Nexleaf, you must honor the data ownership of countries. And, you know, and then we worked with WHO to actually build this into the standards for these devices so that if you got approval, you had to adhere to the data ownership and the interoperability. And then we worked with UNICEF to actually make it part of the procurement. So I share that very long-winded response with you to say that, like, I wasn't even going to mention this, but thank you for the question. This is like one of the types of hard problems that are, I won't say easy to ignore, but tempting to ignore. And it's because it took, quite frankly, like 2 years of my life, like to, you know, work with all these partners, you know, to like really bring everybody together. So, yeah, it's a great example of one of those things, and still is an unsolved problem, you know. And so the latest iteration is now looking at countries are just saying, screw it, we just want to own all of our own software systems. Like, cloud-based systems are not working for us. Like, we don't get access to them. So we're just going to in-house everything. And that's real. So that's kind of the latest iteration, but more to come. Other questions? Yeah.
I would mention that it takes time, right, to get to something as simple as an MOU, but I was interested in how to be able to take interest and commitment that often that time. It's sensitive to over all the time.
Yeah. So the question is, given that it takes so long to get an MOU, how do you really maintain that interest and commitment? And, you know, add to that question, which is like not only government interest and commitment, but really like my team's interest and commitment. Because, you know, one of the things that we often don't talk about in this space is the importance of leadership and keeping your team motivated and inspired, which is, you know, a part of the battle. And so, yeah, it was tough. And the reality is like, I think what I've learned now, which I wish I knew, you know, 6, 7 years ago, because I think I would have stressed a lot less, is like these things all have natural cycles. And like, ultimately, I've come to just trust, like, if the government wants it, then it will come back. And I don't mean that we just like sit back and chill, but like, there is something to letting these things kind of work their way through the system and like for it to become an urgent enough problem. Because I found that I'm somebody who's a little bit like a bulldog. Like I'm like, oh, okay, we got to solve this. So I'm just going to like spend every night, you know, in the government's office, and I'm just going to be there no matter what they're doing. And I'm just going to like, you know, whatever. And I've just realized that's not good for anybody. It's not good for me, but also you start to forget, like, wait, who are we doing this for? You know, am I doing this for my own ego, or are we doing this for the government? So I'm trusting way more now in like this, even though then it does take a long time. And you know, some of them don't work out, which now I'm looking back and I'm like, well, maybe that's for the best, because we do not want to be in that trash heap. That's like number one goal is do not end up in the trash heap. So yeah.
Thanks for all of your good feedback. I love the response here. I have a question. I think it's slightly different direction. I know
Please.
data great and there's a whole lot of interest right now how ambient environmental temperature right makes all that. And I wonder if the data on facility temperature could be a source of data with the Ministry of Health or
I love that question so much. So it's astute of you to like pick up that we are measuring facility temperature. I often forget to mention that. And it's partly because nobody ever asks about it ever. But a conversation that I've been having with my dad, actually, who's a world-renowned climate scientist, is exactly this. Like, we actually, you know, are aware of and helping to host this like pretty insane data set on facility level temperatures. And it absolutely could be an early warning signal of disease and, you know, anyways, all sorts of things. So we have been waiting for somebody to bring this up. So yeah, happy to kind of pick this up. And, you know, just with the caveat that like countries own this data. And so like, obviously, you know, would depend on a country that's interested. But we haven't even approached countries with this use case because we don't have the expertise. And so, yeah, go ahead. So true. So yeah, no, I love it. And if you have ideas, please hit me up. But yeah, it's very true. I mean, in one country, I won't name names, but the Ministry of Energy actually had $70 million from the World Bank specifically to electrify health facilities. And meanwhile, we were working closely with the Ministry of Health, who were in dire need of this solar electrification for their facilities. But we could never get the two of them to talk, even though the World Bank, you know, we had the head of energy come in from the World Bank and she was in this country. We're like, okay, she's here and she got, but we just, the bureaucratic processes are really challenging. So yeah, that is very real. Yeah. Oh, yeah, that's a good question. It's not a no-no I don't think it's a no-no. And in fact, I mean, universities are proof that nonprofits can market and sell commodities. So, I mean, and you all probably have, different experience than I do. So, purely just speaking from my own experience, what I've found is that in global health, there's been sort of a desire to put organizations in boxes. And so you're either a partner, which means you're a nonprofit and, you're funded by Gates or whomever, or you're a vendor and you sell a thing to countries. But to be both has been shockingly this huge source of tension for us. I've spent so much time, like if you go to my website, there's a whole page that says like, why is Nexleaf a nonprofit? So I don't fully understand the provenance of this kind of belief system, but I have absolutely kind of experienced it constantly. And it's been interesting because what I say is, if you have a place that doesn't yet have roads, and this is a metaphor, this isn't real, but like, if a place that doesn't have roads yet, and there's car makers who want to make cars, well, certainly car makers are really good people to consult on like, on building the roads. You maybe don't want the car maker building the road, but their input on, what makes a good road, et cetera. But I think there's a lot of like distrust has been my experience of companies that sell things and a belief that like, well, you're just going to try to maximize profit and you're going to try to, create lock-in. And even though I'm constantly like, no, we're a nonprofit, I make very little money. Like this is, nobody's maximizing any profit here. It has been a constant source of tension. So that's why I brought that up. But I truly believe it's a great model, honestly. And I think if we had more organizations that both sold things and had skin in the game, but also were responsible and took that responsibility as a nonprofit partner, we'd get a lot of cool innovation. But that's just my 2 thoughts, my 2 cents. Yeah. Yeah.
It is inspiring that it leverages government buy-in to expand its reach. What is your experience with cost implications of maintaining the censoring system as healthcare providers may have an additional component to their routine duties? Do governments also provide financial support?
Yeah, so good question. So governments buy these devices from us, and we do sell them at a profit. And we use that profit obviously just to, provide the appropriate tech support and, everything else that's needed to make these devices sustainable for the government. But the reality is that, yeah, it does take extra time from health workers. So far, we have not been approached from a government to actually build in an additional incentive system. And there's a number of different incentive systems that have been tried, like cell phone credits and things like that. But for the most part, that hasn't been an issue, partly because in theory, this device actually saves health workers some time in having to kind of manage these paper charts and, get them aggregated. So for the most part, people are pretty happy with the device, and the question of like incentives for keeping it going hasn't come up. Yeah.
Just going back to a couple of things you said, like a camera search of the demo, like that really, I think people can really relate to that concept, and those of us in global health like feel that tension. So like how early on in your days did you make these connections with the Ministry of Health and really deal with this tension of wanting to be in this space, but also wanting it to be led by ministries of health and for those of us who are
Yeah. Oh yeah. Yeah. Thanks for the reminder. So, and also tell me if I got the question right. So the question is sort of, how do we kind of manage the tension of bringing the ministry in early on? Like, when do we bring the ministry in? And there's like a tension between like kind of building this stuff, but then also ensuring that there's government ownership from day one. Does that kind of capture? Yeah. Yeah. Yeah, I mean, so the funding challenges and the graduation, kind of constraints add a very real constraint to this that, yeah, has been tricky. So a few things. We talk about the ways that things break all the time. So I'll give you an example. When we were a few years into scaling the devices in one country, I won't name which one, the devices were just going offline. And at some point we were at like, I don't know, 70% of the devices had stopped kind of responding. And it wasn't because of the device. It was like things like, well, the SIM card hadn't been paid and blah, 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 right? Just all the other things that cause solutions to not work. And at the same time, Gavi was really pushing to increase funding for this technology. And they were like, we got to get more devices out there, more. And I'm obsessed with scale. So I loved that. And I really had to go and like do some soul searching. But we decided to bring the Gavi board to this country. And basically we flashed up the numbers and we were like 70, it's like, it was painful. It's like 75% of these devices are not responding right now. And here's the reasons why. And we did it with the country. So, you know, the country presented it and they were like, you know, this is what's happening. And so it was hard to do that. And it's not an answer to your question because I don't really have a clear-cut answer to your question, but we've really been working to bring everybody along that like shit breaks and nobody wants to fix it. And like, it's got to start with the donors. And so, you know, even today I spent, you know, half the day at the Gates Foundation and the conversations were all about this. And like, you know, we're all super committed people who are like really, truly trying to kind of do what's best. And it's hard. We all have constraints. Like the Gates Foundation has constraints. You know, it was really helpful to hear, you know, kind of from a program officer's perspective, like the pressure they're under to show results to Bill. And, you know, that's real. And yet, I just keep talking about like, okay, you know, you could go that way, but like, look at this trash heap. You know, I just like flash up the trash heap. It's like, we know where this goes. And, you know, I think I'm about to turn 50 this year and I like therapy and, you know, all sorts of things have really helped. And one of the things that I've like really kind of embraced is like realizing one, I never had any control of anything to begin with. So I'm going to stop acting like I do, but instead really just, I'm there for it. Like I'm, you know, there as a supportive partner and I'm never gonna, you know, kind of bullshit. I'm never gonna lie. So I'm going to keep being like, you know what, 75% of devices aren't working right now. What are we going to do about it? Because I know the country cares and I know we care, but we need everybody around the table to care. Yeah.
Like compared 75% of the
So the question was the 75% ever resolved? And thank you for asking that. Yeah, I always forget to say the good news and the good part of it. So thank you for that. Yes, it is. You know, I would love to actually, if this were my computer, I would pull up the dashboard and just show you. But we're now in that country, we are at like 80% online, which was the agreed upon threshold with the country. So, you know, we sat down with the country, we're like, never going to be perfect, but like, what's going to be enough that, you know, you all are going to want to live with this? And, you know, proof is that earlier this year, the country, you know, bought a whole nother round of devices because, you know, they're so pleased with the intervention and want to keep going with it. So. Yeah. Probably will not. Yeah.
We've had PJs that all these components and what breaks down of them. That's the question to address PJs like solar PJs and some of the natural systems to understand how to build a different pitch that doesn't have so much further.
Yeah. So the question was, you know, technology's advancing so quickly. Surely we can build a fridge that won't break or is simpler and, you know, maybe leverages local technologies. You know, as one example to that, I spent a little bit of time researching think it was like clay-based cooling systems that like really, and I could be getting it wrong, but I think, like we just leverage literally local resources. They exist. What I've finally come to with that is two things. So one, to your question about solar, absolutely, that is the direction that the market is going. So they're now mostly, and I don't think I'll have pictures of them, but solar direct drive fridges, which means that these are no battery, because that was the other issue. Like the old generation of solar fridges all had batteries, and then that introduced its own kind of breakage. So so now these new generation of fridges, they use phase change material, so essentially use the cooling properties of water, and direct solar. So those are working well. They've reduced the number of components, but they still break. And then, there are alternative forms of cooling. We are just, what I've decided is like, we're not the right ones to, be sort of researching that. But an exciting innovation is that increasingly, I think we're getting closer to thermostable vaccines. So that's ultimately a part of the answer. I mean, you're still probably always going to need fridges, especially with mRNA tech. So lots of things to work through there, but I understand we are getting closer, which would be really cool. But insulin and blood, it all still needs fridges, so stuff. Yeah. Woohoo!
But in this time, the slides that we integrated data with national data systems.
Uh-huh.
When you're working with so many nations, so them having a different data system, I imagine there's a lot of challenges.
Oh, we just use AI. It solves all of it. No, I was kidding, but yeah, I will answer that too. Yeah. Maybe I will use that question. And thank you so much. I feel so much less lonely up here with all the questions. So I appreciate you all. I will use that question actually as a jumping off point to actually describe our solution. And please bring that question back if I don't answer it, because it's a good one. So let me go back. Okay, so we were here, the data, process, people, action, this framework. And so let's see. Okay, yeah. So we now, to get away from silver bullet syndrome, what do we do? Well, we implement that data, process, people, action framework. Really does not roll off the tongue in this way. So we have 4 parts of our solution that we build. And so the first is, I'm actually just gonna go a little out of order because this is not working for me. Okay, so the first part is the device, as I mentioned. I think we've talked at length about the device, sends SMS alerts, collects data. And then the second thing we do is we integrate the data into national systems. So the question that was just brought up, how do we do that? And very rightly pointed out that every country has their own data systems. And this was a big part of the conversation today at the Gates Foundation, because it's better and faster and cheaper in the near term to just build whole new data systems, right? And just say, well, here's your new, like, I know I was supposed to give you a chair, but I'm just going to give you all of your living room furniture because, it's going to be way too hard to figure out the dimensions of this chair for your living room. And of course, trash heap, that's what happened. So, so we've taken the approach that honestly, my team every week questions me on. So, we could be wrong, but the bet that we have placed is that building data into the country-owned data system, even if it's, not nearly as good as what we could build and all the things that, we may feel on my team, it's just going to be long-term the way, that's how we avoid the trash heap, the digital trash heap, if you will. So, and to your point, we're still early enough in this journey that I don't even have like, I don't even have like an approach to an answer to your question. So what I'll say is right now, we're just doing the hard work. You just like roll up our sleeves and we're just doing it. I will say a couple of things. One, that work we did with WHO to build out data standards was in part to try to make this easier. That has not yet come to fruition for all sorts of reasons. So what I've told my team is like, listen, right now we've just got to be those like systems integrators that are going to do the thing that nobody else wants to do. And the hard part is not engineering. It really is just like kind of getting people around a table, agreeing on the use cases in advance, so that we're not like integrating all data for all things, but rather, can be strategic and all of that. But it's like, sometimes it just feels like we're event planners, we're just like trying to get everybody into the room at the same time. That's honestly been the hardest part. But yeah, that's my kind of, we're still early in this journey answer. But the other thing I'll say is like, I think the value that Nexleaf, one of the value propositions of Nexleaf, I think is going to be that we're willing to do this hard work. And I'm just hoping that we'll uncover, the perfect AI or some pattern or something that's going to make it easier. But yeah, we have not gotten there yet. I feel like there was maybe some other questions before I roll through this. Okay, I'll just keep rolling, but just interrupt me. Okay, so that's, integrating data into national data systems. Oh, by the way, the other thing I'll say, and my team hates when I say this, I honestly think countries have been coming to work with us because of this thing, that we're saying we're willing to do this because nobody else is willing to. And so, of course, I want to say it's because of our device and because of our great product and all of this, but actually, I think this is a big reason why countries come to work with us. Okay, so then, third part of this is making sure that there's standard processes. And this is standard processes that exist to fix fridges. And so, really, it's like, if anybody's ever run a small business, it's like every month you close your accounting books, right? Or running a department. So similarly, like, how do you close your equipment books every month? Like, how do you kind of just review all the equipment in your country, make sure that you've like closed out any, resolved any conflicts, things like that. So we've been working with countries to co-develop these processes. We are working right now with 4 countries to develop these processes, and then we're going to start testing to see if they actually, scale to other countries. But right now things look pretty good on that. And then we're working to fit the data and visualizations and dashboards into these processes. So like, once we help countries kind of develop these standard processes, then we can standardize the visualizations, and then anybody can build them. You don't need Nexleaf. And then finally, coupled with on-the-job training. So one of the things I'm really interested in, and if people are working on this, I would love to just talk more about this, is on-the-job training. So training is one of those things that's really hard to do well. Adult pedagogy is, rarely used and applied when it comes to training in global health. We, have seen a lot of like vendors just treat it as like a check the box. I showed up, everybody showed up, we did our thing, and then we leave. And yet, like, one of the biggest gaps in fixing fridges is that technicians are like, I don't remember the training, or I didn't go, or I can't find the equipment manual, like super reasonable things. And so we're really looking at how can we actually, jokes aside, how can we leverage generative AI to really convert these one-time expensive trainings into continuous on-the-job support. And it's one of those things, I mean, I did a PhD in computer science, like AI, I've been around it for a long time. Machine learning is like not exciting to me as a concept, but I really think generative AI is going to change the game for this, where basically what we're looking at is being able to build a system so that it can be almost as easy as like you add an equipment manual to the system, and then the generative AI and retrieval augmented generation will just do the rest and like just kind of intelligently grab the right parts from the manual and answer questions. Our early training, our early testing looks pretty good, but we have not scaled it, but users love it because they feel like they've got a friend, a co-pilot, whatever it is, to actually just quickly ask a question like, how are my fridges? And so the generative AI can actually, it now just goes to our database. So you can just do anything from like, where are my fridges failing? How many fridges are failing? I need to run a meeting, who do I need to hold accountable? To like, oh, this fridge doesn't work. Here's the actual model. Give me the most recent manual or tell me what the manual says I should do. So we're just kind of like organizing everything. I'm pretty excited about the potential of that. But so together, those are the 4 parts of our solution. Yeah, go ahead.
Have there been talk you see that launch for vaccine 5 data to the system? I think that bridges have multiple vaccines in them, so we more responsive for changes. Is there a way that this system could then interfaces would say, hey, your fridge off this month, this month, time. Rather than moving these vaccines, but these ones are okay. So that is that more kind of buyers or we automate that way on real life make those decisions. So this like escalation process. Are they still safe?
That's such a good question. I'm going to flip to the very last slide in my appendix, the slide that nobody ever asks about. So I'm like so excited. The question was basically, you know, given that not all vaccines respond the same to temperature changes, how do we actually give slightly more targeted guidance? And I'm going to like build on that question because so the answer is yes, but we're not quite using it the way that you might envision. So yeah, you're just gonna see, oh, there it is. Oh, I lied, it's not the very last slide, but definitely nobody asks about this stuff, I'm sure. Okay, so this is a map of Tanzania, but it's fake data. So, you know, just use it as like a way to think of a map. And so basically what we've done is we can mathematically model, as the question asker was asking, we can mathematically model exactly what the degradation in potency is to a vaccine because we are continuously monitoring temperature. And so we've actually now published it. It's been peer reviewed and like sort of approved. And so it's pretty cool because the math, luckily we didn't have to come up with it. Like it actually is developed by pharmaceutical companies. We just figured out a clever way to adapt it. But so now we can precisely model the different vaccines. And so, you know, for example, measles vaccine can actually stay in a fridge that's running at like too warm for like 30 days. And actually, if a measles vaccine is at 10 degrees Celsius versus like 30 degrees Celsius, it directly impacts. You can think of it integral. It's like area under the curve kind of a thing. So, you know, there's different lifetimes. And so we can model all of that now. And so what we are wanting to use it for, and we have not yet, is less about giving targeted guidance, as you were suggesting, which seems like a really good idea, but no country has asked us for that yet. So, you know, kind of to Patty's earlier question, like we really try to like balance, like not suggesting great ideas, you know, versus like just being responsive, but it's a balance. Anyways, but the thing that we're using it for is we can actually quantify them the dollar value of vaccines that are at risk. And so that's what we're using it for. And so we can now basically put a dollar value on inaction. And we can say, if you don't fix this fridge, it is going to cost you $15,000 in lost vaccine product. And so we have not actually, but this is something that a few ministries have asked us for. It kind of gets to like an earlier question around incentivizing action and like, how do you help drive action? So yeah, so that's what we are excited to use it for. You know, at some point we'll actually roll it out. Did that answer your question?
Yeah.
Cool. Yeah.
When you are speaking the bio product, are there additional things that they have to do, like they put it infrastructure surrounding the product, they internet and electricity and personnel to actually monitor that percent. People should that's something that they
Yeah, it's a great question. So the question is, when countries are buying the device, what is their obligation for providing electricity, providing personnel to oversee all of that? And so it's a difficult balance because on the one hand, who are we to tell a country that they aren't ready to buy this product? And at the same time, again, the trash heap, like I have no desire to do anything that is going to increase the trash heap. So it is a delicate balance, but basically where we've landed is there are some deals that we just won't do because there's no electricity, there's no connectivity. It just doesn't make sense. And we sort of like talk to enough people where we're like, okay, we see that there's like one person who like, you know, really wants this, but it's, you know, not enough. So we sort of will like, you know, just keep asking questions to kind of get to an answer. That's very rare. But the more common is that it's more just that like countries themselves haven't necessarily thought through. Like having an internet connected device is like not that common. And so instead, what we do try to do, we're not nearly as good as I'd like us to be. But I'll describe the ideal situation, which is that like we have like a really fully fleshed out, like, okay, here's the 17 steps and here's a checklist and here's what you need to do in month 1 and month 2. And like, let's make sure that you've planned all these things so you're ready. We're like 40% of the way there. But like, that kind of due diligence in the planning phase, I think will pay off. So it's not quite saying like you've got to do this if you want to buy devices, because like ultimately we are a vendor, but it's trying to be supportive, to be like, great, you want to buy these, like, let us help you think through all the things so that it doesn't end up in the trash heap. Cool. How are we doing for time? Oh, 5:20. You want me to? Yeah. Okay. So then I think what I'll do, let's see, I'll say 1 minute about this, which is, I mentioned it takes a village to fix a single fridge or an incubator, whatever piece of equipment. And so these are just, kind of a sampling of the people within all the users on the ground who really have to kick into gear to fix something. And we've been talking about these users, so I won't, take up too much time. But then there's sort of this like, oh, and you can tell I did this graphic at midnight last night. I'm so sorry. Anyway, so they're part of like an inner circle, if you will. And then there's like an outer circle of partners, and that's, Gavi, it's UNICEF, it's Africa CDC, it's the actual ministry. They're like the Ministry of Finance, Ministry of IT, like all the other kind of ministry departments. And so one of the things that and they all also impact whether this single piece of equipment gets fixed. And so we really think about, with everything we're doing, how do we actually engage everybody constantly? Because it is this like delicate dance, and it sort of gets to one of the question askers earlier about kind of maintaining commitment and interest. It's just as hard actually to maintain the interest of like, UNICEF or, some of these other agencies, as it is like, the nurse on the ground is feeling the pain, they're the ones who see the fridge go out. And so, the challenge isn't there. It does tend to be more, people in Geneva or whatever to kind of just make sure that we're all sort of thinking about this the same way. So that's where I think being a nonprofit has been helpful, where we have been able to raise not a lot lately. Like lately has been really tough. I'm not going to lie to you, but some philanthropic funds to kind of help with that kind of orchestration. And, the results are massive. Like what is possible when equipment works is just like so inspiring and motivating and like transformative. I mean, when this stuff starts to work, I'll just give you, one example that I'm really excited about. Training, the AI enabled on the job training. So much money right now goes into trainings that are like these logistically complicated, expensive trainings. It's costing countries tons of money and donors tons of money. And we have this moment, because a lot of money is going away, is the reality, where like we're gonna need to innovate and we're gonna need solutions that are gonna replace these things that honestly haven't been working. And so, just one example is the Global Fund, which tremendous organization, doing so much in the world. They spend, over the last 5 years, they've spent something like $500 million a year just on trainings, and 30% went to travel. And so, and it's all publicly available. And so you start to think like, okay, what's possible? Well, this money's going away, but what's possible when we can start to do something that could be much more effective? You get the knowledge when you're going to use it. I'm terrible at learning something a year ago and then supposedly trying to remember and apply it. Like I can't do that. So, really like exciting things become possible. And so just as one example, a few weeks ago, one country government called us up and said, listen, our budget went away and we've got some other geopolitical issues that I won't get into. And so we can't travel anymore overnight. The government just told us no more travel. And so, these types of things I think are going to keep happening. And so how do we really kind of stand ready as innovators to like solve those problems? It's like exciting is not the right word, but anyways, it's like a time of like a lot of pain and suffering, but also, a lot of like creativity is going to be needed. So, oh, my final slide. So, you know, one of the things that I do to keep motivated is like I have an animating force, and Bonnie is like my animating force. Like, you know, we talk periodically. He's in the ministry in Tanzania, and really wonderful person. But you know, he said this thing to me like years ago that I just like I finally decided to put on a slide, and he'd probably be like mortified if I was like telling you this, but you know, he said, I need data so I can convince partners of what I need, not the other way around, which I just thought nailed it. And for me, that's like why I do this is like, how do we kind of shift, like even this diagram, right? Like historically, this diagram is like all these outer partners putting pressure in to be like, we're going to go here, we're going to do this. And like, how do we really flip that? So it's like those closest to the patient who are saying, hey, we need to do X, Y, Z, and here's the data to prove it. So that's my talk.
Wow,
Thank you.
okay. Yeah, thank you so much, Nithya. I think I can speak for most of us that this talk was particularly timely. I think many of us are just so thirsty for creativity, for inspiration, and I think you've really provided us with that. So thank you. Some things that really resonated with me. First, listening to our partners, developing interventions that directly respond to their needs, despite the challenges with doing so and the longer time trajectories that takes. Rolling our sleeves up and doing what needs to be done. I think everybody in this room who works in research knows that that is how we do it, why we're so successful in our department is we just do what needs to be done. And I think really importantly, how do we literally and figuratively not contribute to that trash heap? You know, in academia, I think we sometimes feel that like anybody can kind of write a paper or maybe get a grant, but how do we do it in a meaningful way that really makes impact? So thank you for reminding us that that's our goal. So we're not done. You're not allowed to go yet. We have a reception on the 8th floor. So please, if you're joining us, it goes until 6:30. Go out this room or out this door, elevators down here to the 8th floor. We also have more happening tomorrow, and we'd like to invite you to attend smaller group discussions. The first is at 8:45 a.m. These are all in person. The topic is leveraging data science and tech to advance global health equity. That's in room 797. You can reach out to Hannah if you need more logistics, but hopefully you're on email chains about this, but this is just a reminder. At 10:45, we will be discussing navigating our current funding environment and leveraging strategic partnerships, also in 797, and then at 2:15, building strategic partnerships in global health in 772. So we hope some of you will join us tomorrow for some continuing of these really important conversations, and see you on